All right, so let me jump in. My name is Jessica Lehman. I'm the Executive Director of Senior and Disability Action, and we organize seniors and people with disabilities to fight for change in our communities on all the issues that affect our lives. And I'm really proud to be here today as part of the California Care Rationing Coalition, which is an incredible coalition of some really powerful folks from around the state, from senior groups and disability groups and other advocacy groups and individuals who want to make sure that all of our lives are valued. So one of the things I was thinking, there was a headline that really hit me about a month ago now, I believe, that said, COVID only affects older people. And then they said, only with a question mark. And it was this realization that for so many people, it seems okay if older people die, or at least it's much less terrible than younger people dying. And those of us who are older or disabled or both live daily with ableism and ageism, which I would define loosely as oppression or discrimination based on disability or age. And we experience people pitying us, people assuming our lives are miserable, doctors and health professionals assuming that we won't live very long. We deal with lack of access or people refusing to hire us for jobs. And suddenly it is clear how those stereotypes are literally killing us in the form of care rationing. We're seeing care rationing in terms of how do we either consciously decide who gets care for COVID-19, and in the unintentional ways that we either provide or don't provide good mechanisms for prevention, treatment, and care for older people and for people with disabilities. So we're here today because we are at a real deciding moment in California regarding COVID and regarding how we think of older people and people with disabilities. So very soon this week or next week, Governor Newsom may act on a request for immunity from the nursing home and the healthcare industry, saying that if they make a mistake, if something happens, that they will not be held accountable for that. In addition, we are in this momentous moment of the state working on care rationing guidelines about if there are not enough hospital beds, if there are not enough ventilators, who gets care and who gets care first. These may sound like separate issues, but they are both about the direct impact on the lives and deaths of seniors and people with disabilities. So today is about changing that process to include senior and disability communities. We are not just asking to be cared for, to be paid attention to. We are demanding that our voices and experiences be heard, that we are the ones to improve policies and save the lives of our community members. So I really thank all of you for being here today to hear those voices and to report on these life or death issues. All right, so let's go ahead and get started. We have 6 or 7 speakers today, a lot of different experiences to really put a face and some substance on this issue. So we're going to start with Nicole Howell, who is the Executive Director of Ombudsman Services of Contra, Costa, Solano, and Alameda counties.
Thank you, Jessica. I appreciate the work you and others are doing to bring light to this issue, and I'm simply honored to be a part of this conversation. So I and my team serve 29,000 vibrant, smart, funny, older, and individuals who experience disabilities who live in long-term care, and we advocate on behalf of their needs. And through our work, we resolve more than 3,000 complaints a year related to quality of life and quality of care, as well as preventing and intervening on behalf of issues related to abuse and neglect. And the individuals we serve are deeply engaged in the business of living and enjoying life every day to the fullest extent possible. And they turn to their ombudsman and licensing and other advocates to help resolve these issues so they can continue to thrive wherever they may reside. And when these residents and their families made the challenging decision to move into a long-term care setting, they did so with the full understanding that they would be able to continue to live with dignity, and that they would still be able to have their evolving needs met in this licensed long-term care setting while they were still deeply engaged in their community, their friends, their family. But as COVID-19 has drastically reshaped our lives, it has perhaps been most acutely felt within long-term care settings, where ability to move about inside the facility, outside the facility, access their friends and family, as well as their advocates and licensing has been severely depleted. And when you couple that with the drastic revisions in regulations and ever-changing environment, I think that creates a really dangerous structure for residents, their families, and protections. So over the course of the past 8 weeks, we have seen regulations drastically reduced and thrown out at a rapid pace, with little regard for the lasting impact on the residents and their families. And residents have the right to resolve issues on their behalf, but these licensing regulations make that more difficult for them to do. And when we talk about facilities potentially absolving themselves of responsibility or the rationing of care, that is most acutely felt by individuals who live in long-term care, who at this point do not have the same access to advocates and regulations that they have in the past. So I really invite all of you to join this movement and understand the lives of older adults, individuals who experience disabilities, and find ways that we can actually broaden the movement of care, not limit that. So I just want to thank Jessica and everyone else.
Thank you so much, Nicole. I think we all appreciate the reminder that, you know, when people go into long-term care facilities, they're less visible to society, but that doesn't mean that they want to be less active or that they feel like they're done living. Mm-hmm. So thank you for that. All right, next we're going to turn it over to Michael Dark, who is a staff attorney with CANR, California Advocates for Nursing Home Reform.
Yes, thanks, Jessica, and thanks for the opportunity to speak today. At CANR, we advocate for people in long-term care in California, seniors, people with disabilities requiring skilled nursing, and people with serious medical conditions. These are the same people that the COVID virus targets like a laser. And we're here today because we're angry and because we are afraid. Right now, residents of nursing homes and assisted living facilities in California are already getting almost no protection, as Nicole has pointed out. Their families are barred from visiting them. Regulators are no longer making routine inspections. There's no safety net left, but the prospect that a dangerous or a reckless operator can be sued. But Governor Newsom is poised to sign off on an executive order requested by the California healthcare industry lobbies that would give immunity to nursing homes for administrative, civil, and even criminal claims related to COVID. Such an order would be a devastating blow to our communities. If you're driving down the street and a drunk driver dangerously swerves into your lane and puts you in the hospital, you can sue that driver. And suing not only helps compensate you for your expensive medical care, but it discourages people from that kind of reckless conduct. And under the immunity proposal that Governor Newsom is considering, a nursing home could recklessly and dangerously put a resident at risk by not giving them necessary care, or even by abandoning residents who are desperately sick, and they could not be sued. But that also means that nothing is left to discourage those facilities from putting residents and even workers in those facilities in grave danger. We can't have two different standards, one for people getting COVID-related care in nursing homes and another for people driving down the street. We can't value the lives of people who are older and who are disabled less than the rest of society. If that happens, we aren't just dealing with a viral pandemic, we are dealing with a collapse of basic humanity, of decency. This isn't about attacking the healthcare worker heroes on the front line. Those workers at these facilities are making minimum wage, and they are often being put in danger by facility operators every day, just like residents. It's about having accountability for the industry and about valuing the lives and the bodies of the elderly and the disabled as much as we value the lives of everyone else. I'm speaking directly to Governor Newsom now. Don't abandon us, Governor. Reject this immunity request and send a message that all of us, able-bodied and disabled, old and young, are truly in this together. Thank you.
Thank you so much, Mike. Really appreciate those comments and the reminder that while most or all of us don't like turning to lawsuits, sometimes there's no other way to enforce laws. I know people are always surprised when I talk about the ADA, the Americans with Disabilities Act, and how little enforcement there is, and that it takes people willing to put in the time to file a lawsuit to get it enforced. And so we need to have those mechanisms available, and we need to know that that's there. And thank you also for bringing up that we are here also to support the staff in nursing homes and other long-term care facilities who are also incredibly at risk. We know the Latinx community has been disproportionately impacted by COVID-19, and we know that it is so many women of color, particularly Latinx people who work in facilities in California and who are earning low wages, who don't have good benefits, who don't have good sick leave. And we need to be there to support each other and to make sure that we are valuing people instead of the profits going to these for-profit facilities. So I will get off my soapbox and turn it over to our next person, Elizabeth Rigsby, who is a self-advocate who I've been really honored to work with in San Francisco. Please go ahead, Elizabeth.
I used to live in a boarding care home for about 6 months until I was able to get my own apartment. And that experience, knowing that people who work in the boarding care have a lot of people they have to go between on a timely manner. So it's like they really don't have the time to really make sure everyone is safe and hygienically taking precautions over this COVID-19. Like the gentleman said, Gavin Newsom, you can't sign this. You can't sign this thing because that's telling the disabled community that it's okay, that you really don't matter. It's okay. It's not okay. Just because we are disabled doesn't mean we don't have a value over our life. What gives people the right to say who's eligible to get care or not? It doesn't matter. Elderly and people with disabilities, we do matter. And Gavin Newsom, I just want to say that if it wasn't for the people, you wouldn't be in office. So you have to remember who voted you in. It wasn't politicians. It was actual everyday people, citizens. And that's what you need to look out for. Hold these places accountable. Make sure they're doing the right thing. Make sure that they're keeping people with disabilities and the elderly safe. It's not enough just to pass them by and say, oh, they're gonna die anyway. No, they have a right to live just like everyone else, and that they need to be treated with dignity and respect. And I just want to say one more thing. Gavin Newsom, if you live long enough, you're gonna get old yourself. So remember, when you get old and you need somebody to take care of you, just remember, you might be in the same boat. So just because you're young and vital now, it's not gonna last forever. Thank you.
Thank you so much, Elizabeth. It's a really important reminder that we're talking not just about people living in skilled nursing facilities, which get called nursing homes, but also the thousands of people with disabilities living in group homes and other sorts of facilities around the country, around the state. Okay, so we're going to change the order a little bit because I know someone needs to leave us soon. So I'm going to, I was going to ask Ira X Armstrong if you'd like to go next. Does that work for everyone? Yeah, okay, great. Sorry, I'm trying to see folks here. So Ira X Armstrong is a Berkeley resident and a former city council candidate, a member of the No Body is Disposable Coalition, as well as Fat Rose, and development director at Peace Out Loud, and co-founder of Out Loud LLC. Thank you, Ira. Please go ahead.
Thank you so much. It's an honor to be with you all this morning. After coming down from the mountains this past President's Weekend, I ended up in the emergency room with what I thought was a very bad case of altitude sickness. Now I think it was the beginning of being sick with COVID-19, which my doctor also confirmed. I had lost my sense of smell and felt dizzy, but they didn't know to screen for those symptoms then. My oxygen level was 86, then 90. They sent me home. I didn't know till later that those oxygen levels are critical. It's been day by day with my own health since then. I'm literally just doing my best to stay alive long enough for my lungs to heal. I had a fever on and off for over a month. I couldn't walk a block and a half without being out of breath. I found myself thinking, after 44 years, maybe I've had a good run. When I heard myself thinking those thoughts, I knew I needed care. I reached out to Disability Justice Culture Club, who offer mutual aid to disabled people of color in the East Bay, and they advocated for me, and within a few days, I had an oxygen concentrator. I've been able to breathe and walk again, and I have some sense of hope that I can survive this thing. Now I test COVID negative, but I have lung damage and I don't really know where to go. If I go into a hospital, I may not come out. The crisis care plans are too discriminatory against disabled and chronically ill, fat, trans, and Black folks, and I check every one of those boxes. In an ideal world, a skilled nursing facility could treat me well. But instead of lobbying to improve care, hospitals and nursing homes are currently seeking immunity if they kill COVID patients like me. And death is not even what terrifies me most. I'm clear that I'm connected through my ancestors to everything that has ever been and everything that ever will be. What terrifies me most is that people are making decisions that impact how we will feel about ourselves as human beings for the rest of recorded time. We have the option to feel proud in our choices of solidarity and care, or feel shame at the choices of eugenics and expediency. I want to be able to tell my grandchildren with pride about this time when we slowed down, when we said there's no one who deserves to die like this. And I want that story, whether I live or die. I want the story of care. And at this time, our governor has the chance to make a bold choice to lead with love, rather than being the kind of white moderate who Dr. King lamented in his letter from a Birmingham jail. Governor Newsom has this opportunity to make California into a real, live, beloved community, a real California for all, and I implore him to do that. Thank you.
Thank you so much, Ira, for that powerful and painful story and the reminder of the different ways that the state's triage guidelines and the potential immunity for nursing homes are just a double hit against people with disabilities, older people, and I so appreciate you pointing out about trans people, people of color, Black people, fat people. So thank you for being willing to share that. I'm going to introduce next Stacey Milburn, a wonderful friend of mine, an Oakland resident, and one of the founders and leaders of the Disability Justice Culture Club. Stacey, go ahead.
Thank you, Jessica, and thank you, everyone. It's been pretty scary to navigate COVID-19 as a ventilator user. I was quite frightened early on when my doctor shared that I would likely not survive an exposure. My caregivers who were not able to fully shelter in place have had to step back from working with me. As a disabled person, it felt really critical not to get sick. I saw a public safety alert from Santa Clara County asking people to identify if they use a ventilator for county inventory. I need my ventilator to breathe. My friends and I made emergency plans about what to do if someone shows up at my door asking for my backup ventilator. I was getting advice from friends in medical fields. If disabled people get sick, we may not get care. We may be turned away. We may be discriminated against. This is the key reason why my friends and I, with the Disability Justice Culture Club, started organizing a mutual aid project to support disabled people in the East Bay. We are currently supporting over 100 people with disabilities and staying safe as possible so they do not wind up getting sick and needing to navigate a discriminatory healthcare system. The disability community has a long-standing mistrust of the medical system, yet we have to navigate it every day, especially Black, Indigenous, and people of color whose pain is not taken seriously, not believed, and historically have faced resource and healthcare deprivation. It is well established that Black people in the United States experience more illness, worse healthcare outcomes, and premature death compared to white people. Doctors take an oath to treat all patients equally, yet we know that this is not the case. This is why there has to be checks and balances on hospitals and nursing homes. Otherwise, disabled people, especially people of color, are left alone in a system that already doesn't care about us. Everything that we have right now in terms of community living and appropriate medical care didn't happen by itself. Disability rights advocates and racial justice advocates fought long and hard for it, and will fight long and hard now for our people to survive COVID-19 and discrimination. Thank you.
Thank you so much, Stacey. I'm going to turn next to Dr. Elena Escalera. Dr. Escalera is an Oakland resident, a member of the Nobody is Disposable Coalition and Fat Rose, and a professor of health psychology at St. Mary's College. Dr. Escalera.
So I am incredibly frightened of exposure to coronavirus. We know the virus is affecting Black, Latinx, and Indigenous people more. We're often on the front lines in essential worker jobs, and we have experienced health disparities due to systemic discrimination. This is also true for fat people. If I get COVID when resources are scarce, I will die. They will reserve that ventilator for a thin, young, white, able-bodied person who got sick traveling on spring break. It's the discrimination that's going to kill me, not my lung function from COVID. Disability and race discrimination are supposed to be illegal. California shouldn't tolerate discrimination, even if other states do. Isn't California supposed to be a California for all, as Governor Newsom has said? Medical discrimination is this extra layer of fear we cope with as Latinx, Black, Indigenous, disabled, older, and fat people. I wish it was paranoia, but it isn't. Instead, Governor Newsom is considering immunity for the medical institutions that discriminate against us and kill us. We can't let skilled nursing facilities become death camps for COVID patients. Patients need to be treated as individual people, not mass populations. I understand health provider immunity might be sold as an opportunity to get elective surgery available more quickly. I am actually waiting on elective surgery myself, and my career actually hangs in the balance. I may lose my job as a tenured professor if I don't get my surgery quickly. But I don't want masses of people to die for my individual surgery. People don't need to die so hospitals and rich people can get richer. It's not a competition between people who need surgery and people who need COVID care. We're in cooperation. We're all worthy of care.
Thank you so much. I love that last part. We're all in cooperation. We're all worthy of care. And thank you for drawing out some of the profit motives here for hospitals to push their COVID patients out so they can do more elective surgeries that bring in money, many of which are not really elective, right? We need those, so that's important that those happen. But hospitals can do some of those surgeries and keep people with COVID there rather than sending them to nursing homes or assisted living facilities, and then those facilities making money off them and at the same time getting immunity. Okay, so our last speaker is Dr. Joseph Stramondo, who is Assistant Professor of Philosophy and Associate Director of the Institute for Ethics and Public Affairs at San Diego State University. Please go ahead.
Thank you so much for the opportunity to speak today. And thank you so much to the other speakers for sharing your thoughts and your experiences. As someone who works in bioethics, I think it's oftentimes the case that bioethicists lose sight of the human element of all of this when talking about things like crisis standards of care. And so hearing the personal stories is really essential. So at the end of the day, when we're talking about crisis standards of care or rationing protocols to decide who gets what care, what we're really doing is reflecting on our deepest collective values as a society. In a way, this process asks us to reflect upon who we are by way of what we value. I believe that all problems that have been raised with rationing schemes in general, but also specifically the ones in California, boil down to the notion that they put too much emphasis on the value of efficiency at the expense of the value of equality. So this is not a new problem for the disability community. Whether we're talking about ramps or ASL interpreters or education accommodations or access to home and community-based attendance or ventilators, the history of the disability movement is the history of the struggle between efficiency and equality. We're used to having our equality dismissed in the name of efficiency. For decades, we've organized around the notion that recognition of our equality is worth some inefficiency. Saving more rather than fewer lives is important. That should be a goal of the crisis standard of care, but it shouldn't be the only goal of crisis standard of care. Recognizing the equal value of every life is also important. Crisis standards of care that try to maximize the number of lives saved by discriminating intentionally or unintentionally based on disability, age, race, gender, and so on, fail to recognize the importance of striking this balance. Now more than ever, the disability movement demands recognition that we are worth the cost of our own flourishing. Thank you.
Thank you. It's great to finish with a bioethicist with showing that we have so many different angles, so many different perspectives, all pointing to the need to not have any sort of immunity for nursing homes and other health facilities, as well as to have crisis guidelines, triage guidelines at the state level that explicitly value people with disabilities and older people, and do not decide who gets care based on those categories. I also wanted to say, as far as the timing on the guidelines, there's some question about how the state's triage guidelines may be tied with nursing home and other facilities immunity, and it's just a reminder that until we have healthcare for all, we really have to be serious watchdogs on this system where there is focus on profit and where all of this is tied together, because it's a healthcare industry right now, and there's a lot of money in healthcare lobbying, and unfortunately people's lives, particularly the lives of seniors, people with disabilities, fat people, people of color, are often sacrificed, is really what it comes down to. So thank you to everyone who spoke today about why that is not only a huge problem, but it's also not needed. It is not the direction that we can go as a state.